Hello, my name is Penda Boma. I am a student of Nightingale College. Today I have my badge. I am not dressed in my appropriate uniform based on delay from the school to deliver my scrubs. But today we are going to be performing Colostomy Care skill video. For this reason of the video, I have my colostomy bag and my base plate already on the patient as demonstrated with the simulator. I have my gloves, I have 2 washcloths, my measuring equipment, hand sanitizer, and the stomach paste. I have all my equipment. I'm going to go ahead and knock on the patient's door. Knock, knock, knock. The patient grants me access. I walk into the patient's room, close door behind me for patient's privacy, close the curtain for patient's privacy, introduce myself to the patient. Hello, my name is Penda Boma. I'm going to be your nurse today, and today we are going to be changing your colostomy bag and cleaning your stomach. I'm going to go ahead and ask the patient for the date of birth. The patient tells me the date of birth. I check their wristband, make sure that I have cleared the 2 patients' identifiers. I'm going to go ahead and perform hand hygiene. And I'm going to go ahead and put on my gloves. Hello, Mr. Smith. I'm going to start by taking off your old pouch, okay? So I'm going to go ahead and take off the patient's old pouch. It should normally snap out by itself. I'm going to check on the discharge in the old pouch, its contents. I'm going to go ahead and discard of it in a toilet or in the approved bin. But if indicated by the provider that we record the discharge, I'm going to go ahead and record how much is in the bag before I discharge it. Mr. Smith, I'm going to go ahead and take off the base plate, okay? For the sake of these, it's important to go slowly in order to avoid tearing the patient's skin or irritating the patient's skin. So normally you want to go from the side, pull it towards you, towards you, towards you, towards you, and slowly get it out. Okay. Put that in the trash. Now I'm gonna go and get washcloth in some warm water and use approved solution. I am going to clean around the stomach in a circular motion from the inside out. Put this in the trash. At this moment, I'm going to examine the stomach. I'll make sure it is beefy red and not blue or purple. If it is blue or purple, I'm going to go ahead and indicate that to the provider immediately. So I'm going to look at it. I'm also going to palpate the skin around the stomach. Hi, Mr. Smith, how you feeling? Do you feel any pain as I palpate the skin? I'm going to be looking for any skin deterioration, any odor, any discharge, and any skin irritation like reddishness. At this time, I'm going to go ahead and measure. I'm going to go ahead and measure the size of the ring I will be needing for the change of these. So we're going to go ahead and measure the ring around the stomach to make sure we have the accurate one to use for the new base plate. Okay, this one is 41 millimeters. It looks good, but it looks a little bit too small. So we're going to try another one. Okay, yeah, this one is 45 millimeters. This looks actually good and better. So I'm going to use this one. So I get my base plate. and I want to measure against. Put the measuring guide against the base plate. I will go ahead and trace it. With a pencil. Then I'll cut it out and apply it to the base plate. At this time, I am going to go ahead and dry around the stoma with another dry piece of cloth in a circular motion from inside out. Okay. I will apply my stoma paste around the stoma. This stoma paste is going to help to seal the base plate and to avoid skin irritation. So I will go ahead and soon as my stoma paste is dry, I'll go ahead and apply my base plate. I need to take out the white covering behind it, behind the base plate. Take it out. Take it out. Make sure you take all of it out. Now that it's all out, I'm going to go ahead and apply the base plate on the stoma, on the patient. Okay, make sure it is well sealed. Okay, no leakage, make sure it is well sealed so that there will be no leakage. If it leaks, that will be a bad thing. We have to do it all over again. At this time, I'll go ahead and apply the new pouch on the new base plate. Before I do that, I'm going to secure the end. Secure the end. This is going to go on by clamping it. You will hear this. You will hear that little sound right there. It is well secured on the patient. You want to check and make sure it is well secured on the patient. Okay. At this time, I'm going to go ahead and put my patient in a comfortable position. Have the patient put their hand over. Before I put my patient in a comfortable position, I will have my patient put their hand over the pouch so that their body heat can improve the sealing of the base plate to their skin. So after a couple of minutes, I'll have the patient in a comfortable position. Ask them how they are feeling. Hi, Mr. Smith, how you doing? He confirms he's feeling good. I'm going to take off my gloves. Put that in the trash. Provide Mr. Smith with a call light and advise him to use the call light if he needs help getting up or doing anything that he needs. I'm going to go ahead and perform hand hygiene. And I will exit the patient's room and I will go and document my procedure and any findings in the patient's chart. Thank you.